The title of my pep talk today is what are the ROJoson strategies to make patients empowered? The empowerment objective is for the lay people to have understanding of strategies on patient empowerment, how to cultivate it, and how ROJoson does it. The World Health Organization has identified 4 components as being fundamental to the process of patient empowerment. 1, understanding by the patient of his role, acquisition by the patients of sufficient knowledge to be able to engage with their healthcare provider. 3, patient skills. And 4, presence of a facilitating environment. It ends up with a summary statement on the definition of patient empowerment, which is a process in which patients understand their role, are given the knowledge and skills by their healthcare providers to perform a task in an environment that recognizes community and cultural differences and which encourages patient participation. If we were to translate patient empowerment into Tagalog terms and concepts, I would put it this way. Pagpapalakas ng pasyente, and pagpapalakas encompasses the following concepts: karapatan, knowing your rights as a patient, responsibilities, and empowering yourself by cultivating competencies to manage your rights and your health concerns and issues through the following: kaalaman at kakayahan, meaning knowledge and capability, and makapagdesisyon para sa kanyang kalusugan or self-determination. The underlying principles of patient empowerment consist of the following. Every person has the right to make his own choices with regards to his health care. And every person has the right to be the primary decision maker with regards to his medical conditions. To cultivate empowerment, all patients should be made aware of and should exercise their rights to manage their own health concerns and issues, rights to participate actively and fully with the attending healthcare professionals in the decision-making regarding their health concerns and issues. And to cultivate empowerment, all patients should develop competencies through self-directed learning and with the assistance from healthcare professionals on at least the following so as to facilitate proper decision-making for their health. Basic knowledge, skills, attitude, or competency in managing their health concerns and issues within their capacity and capability and within their environmental and cultural context, how to participate actively and fully with the attending healthcare professionals in the decision-making regarding their health concerns and issues. Rational and cost-effective processes of patient management and realities inclusive of peculiarities, idiosyncrasies, and limitations of medicine in the administration and management of healthcare. Thus, the first step in the patient management process, after knowing the processes, is to know and understand your rights as a patient in getting the highest attainable standards of health through the quality and safe services to be provided from the healthcare professionals and institutions that you seek or consult. Thereafter, aim or exercise these rights. So take note of your rights to quality health services from your healthcare professionals and institution. People-centered, meaning providing care that respond to individual preferences, needs, and values. Equitable, meaning providing care that does not vary in quality on account of gender, ethnicity, geographic location, and socioeconomic status. Safe, meaning avoiding unwanted injuries. Effective, providing healthcare services proven to be fruitful and successful. Efficient, meaning maximizing the benefit of available resources and avoiding waste. Timely, meaning reducing waiting times and harmful delays. And integrated, meaning providing care that makes available the full range of health services throughout the life course, holistic and well-coordinated. Also take note of your other rights, particularly in a hospital setting. Quality and safe healthcare in accordance with generally approved medical principles. Respect and dignity without discrimination. Participation in care decisions. Informed consent and informed refusal without prejudice to continuing healthcare. Second opinion from alternative or alternate healthcare professionals of choice. Privacy and confidentiality of personal information subject to applicable laws. Availment of benefits and privileges in accordance with government regulations and to be billed accurately. Complaint about the care and services provided without fear of reprisal. The second step, after knowing and understanding your rights as a patient or potential patient when getting the services of healthcare professionals and institutions, is that you should be responsible in cultivating competencies in managing your rights and your health issues and concerns. The healthcare professionals and institutions are your partners and assist, but eventually the decision is yours. You should gain control on what to do with your health issues and concerns. To cultivate competencies, you must use problem-based learning and self-directed learning approaches. Problem-based learning is defined as learning acquired while or after solving a certain real-world problem. Self-directed learning is learning on one's own initiative, with the learner having primary responsibility for planning, implementing, and evaluating the effort. You can also have formal structured tutorials, either online or face-to-face, with experts to develop your competencies in managing your rights and health concerns and issues. You must have completed a basic course on diagnosing health problems and strategies and usual management on health maintenance and restoration. Whatever you learn, you must practice it for the best results and for mastery of learning. ROJoson strategies on patient empowerment. The main strategies: making patients aware of their rights on their healthcare management and educating patients on how to manage their health with or without the assistance of healthcare professionals. Awareness of rights as patients. This includes promoting self-determination, meaning deciding for oneself, and participatory management in medical care with the healthcare professionals. Education, to acquire competencies on the following: learning, health, and illness through problem-based learning and self-directed learning. skills they can perform to promote and to restore their health, processes of management and not simply memorizing management guidelines, and lastly, skills in engaging with their physicians when the latter are consulted. So ROJoson Patient Empowerment Program is basically education of the public or lay people to enable them to take control in the management of their health, more specifically to equip them with basic knowledge, skills, and attitude to make educated or well-informed, rational, and cost-effective decisions on their health concerns. How does ROJoson do the education? One-on-one explanation, discussion, and teaching with individual patients and families during face-to-face and telemedical consultations, lectures to groups, online collaborative and interactive learning modules, blogs using WordPress and Google Sites, YouTube, SlideShare, and script publications, social media, particularly Facebook, and PEP TALK. Since May 15, 2021, I have added a ROJoson PEP TALK. This PEP TALK is designed to be a regular online or virtual talk by ROJoson on health concerns and issues. It is done on a once-a-week basis using Zoom apps. The talk is limited to 1 hour with less than 20-minute talk, followed by 20-minute question and answers and interactions. The audience is limited to 15 to 20 persons per every sessions. The talk is accompanied by an online learning evaluation test exercise or OLETE after the sessions. Attendees who get a perfect score in the OLETE will be issued a certificate of commitment and accomplishment. Like this, a sample of the certificate. After accumulating 50 such certificates in 50 PEP talks, an attendee is entitled to a voucher for a free ROJoson Telemedical Consultation. Like this. The general objective of the PEP talk is to empower patients or lay people on health and illness. It is essentially a ROJoson online collaborative and interactive learning on patient empowerment course with an online learning evaluation test exercise or OLETE after each PEP talk to promote mastery of learning. I have the following topics rolled out for the next 3 to 5 years. So I have done the ROJoson PEP talk module on COVID-19 from May 15, 2021 to June 8, 2021. I'm now on my second module, ROJoson PEP talk module on patient empowerment. This will run from June 19, 2021 to July 3, 2021. The other topics that will be included are patients' rights in patient empowerment, patient management process, realities inclusive of peculiarities, idiosyncrasies, limitations of medicine in the administration and management of healthcare, individual health management, and medical emergencies and first aid. Takeaway in this PEP talk, the WHO strategies for patient empowerment, understanding by the patient and of his role, acquisition by patients of sufficient knowledge to be able to engage with their healthcare provider, patient skills, and presence of a facilitating environment. WHO has defined patient empowerment as a process in which patients understand their role, are given the knowledge and skills by their healthcare provider to perform a task in an environment that recognizes community and cultural differences and which encourages patient participation. The ROJoson strategies to empower patients can be summed up in these Tagalog terms or version: pagpapalakas ng pasyente, pagpapalakas encompasses karapatan or right as a patient, responsibilities for self-cultivation, leading to kaalaman and kakayahan or knowledge and capability, and makapagdesisyon para sa kanyang kalusugan or self-determination. ROJoson main strategies on patient empowerment: making patients aware of the rights of their healthcare management, educating patients on how to manage their health with or without the assistance of healthcare professionals. This ends my PEP talk. What are the ROJoson strategies to make patients empowered? I hope I have empowered you, okay, to have an clear understanding of the strategies on patient empowerment, how to cultivate it, and how ROJoson or how I do it. Mabuhay kayong lahat.